as we know that we are gathered here to continue the legacy of the great scholar or the Murabbi, Professor Malik Babakar Badri Muhammad, of course, who has started or give or provide us the path to work on Islamic psychology. It is unfortunate with me that I could not meet him because the year when I joined University of Malaya as a as a professor in the Department of Educational Psychology and Counseling in the year 2005, he was not there. But anyhow, though this was not the demand from the university's end to write or work in the area of Islamic psychology, but frankly speaking, I started working in the area of Islamic psychology in the year 2005 when I joined University of Malaya, Kuala Lumpur, and wrote a book on Islamic psychology, emergence of a new field. It was published in the year 2006. Within that, I covered two great Indian scholars, that is Shah Waliullah Dehelvi and Maulana Ashraf Ali Thanvi, whose contribution is also great in the field of Islamic psychology. And based on this writing, I contributed one chapter in the edited book of Islamic psychology around the globe uh, by Ambar Haq and Abdullah Rathman. Okay, with this brief, now I am going to share my views on or the work that what we are proceeding or are doing or conducting in the area of Islamic psychology, particularly in Islamic counseling. So today's my presentation is Islamic psychology in clinical practice. So this, of course, the role of, as we know that the role of religion and spirituality in clinical practice has been extensively studied in the last few decades, with significant research indicating substantial progress in the successful integration of spirituality and religion into clinical practice. So at the end of the 20th and beginning of the 21st century, clinical psychologists and researchers have entered into the new field of psychology, that is faith-informed psychotherapy and intervention procedures for Muslim clients with mental health and physical health issues. So in recent years, we are integrating uh, spirituality as well as the religion into to the treatment. The growing research within the last 3 decades in the area of Islamic psychotherapy can be broadly divided into two categories. One is studies oriented towards building theoretical models of Islamic psychotherapy or psychological constructs like Abdullah Rahman is working and on it, as well as the Malik Badri. He also did work on Islamic or you may say contemplation, particularly meditation. The empirical studies showing the efficacy of Islamic psychotherapy and Quranic therapy for the treatment of mental and physical health issues. So, of course, as you know, that on the first day of this conference, I mean, I introduce or release one of my annotated bibliography that is on studies in empirical studies in Islamic psychology. So based on this, in this lecture, I made an attempt to highlight the role and efficacy of Islamic belief system, Quranic recitation and zikr and prayer to alleviate the health issues of Muslim clients. So the method basically we followed in this is empirical studies, which were carried out in the past 3 decades or more. That is the database, namely PubMed, PsychoInfo, SpringerLink, Web of Science, Scopus, Index, Copernicus, ResearchGate, and Google were used. So most of the studies were found in the Journal of the Islamics, Journal for the Psychology of Religion, Mental Health, Religion and Culture, Journal for the Scientific Study of Religion, Journal of Religion and Health, Journal of Muslim Mental Health, and a number of refereed and peer-reviewed journals. The following terms formed on the basis of research study, that is Islamic-based belief, Islamic religiosity, Islamic faith, prayer, Muslim prayer, zikr, therapy, Islamic therapy, Quranic recitation, and prayer and healing. So of course, we independently searched and screened the titles of the studies and discussed the possibility of including those empirical studies which were included if they were conducted on Muslim clients and related to different behavioral aspects. The theoretical studies, deliberately, we have excluded theoretical studies uh, because there was a lot of repetition and it was beyond the scope of the present lecture. Then the full text of the potentially relevant empirical studies were thoroughly reviewed. And this is the diagram, I mean, which is or the figure which is depicting that the studies on database, Psychoinfo, Web of Science, and Copernicus, and reports after the removal, the duplication of the studies. So of course, studies when we reviewed basically in the past 35 years included criteria and Eastern countries, no gender and age restriction, generic and patients population with survey and randomized control group design and studies. And this leads to studies excluded based on exclusion criteria, theoretical articles, conference abstract, studies based on student population, unpublished master's dissertation, interview based on studies and reports. And the studies included in this particular, my lecture is final review 30. As findings from the year 1995 to 2021, studies in the area of Islamic psychology have largely examined the correlation of Islamic belief with a number of behaviors such as mental well-being, psychological well-being, organ donation attitude, aesthetic surgery operation, personal well-being, and the life satisfaction. The different effects of Islamic belief are found on health-related behavior. Some have reported a positive impact, while others have reported a hampering effect. The positive role of Islamic belief is found, such as women breast cancer patients did not find Islamic belief against the health behavior, such as self-breast examination. So, of course, contrary to these studies, Musuli and Demir 2020 revealed the negative role of Islamic belief among 96 patients who were recommended plastic surgery but rejected to have one. Even those who accepted plastic surgery considered it as a sin according to their belief systems. So of course, Benetilla et al. 2021 have paved the way toward and shown that Muslim patients rely more on treatment protocols attuned to Islamic principles and teachings. Among those who have experienced some of other type of traumas, Islamic cognitive behavior therapy have been found effective in healing the trauma. Similarly, Islamic cognitive therapy sessions comprised of activities such as listening to the life stories of prophets who have experienced trauma and participation in group informal prayers. Such a form of therapy has been found efficacious among Somalian trauma patients like Bentley et al. 2021. So a few scholars have examined the association of demographic variables such as age, gender, marital status, level of education with the Islamic prayer activities, experience and attitude towards prayer among cancer patients in Iran. Of course, as we know that one of the spiritual exercise Islamic practice that is the prayer, and prayer is a number of studies which prove that prayer is found altering the physiological arousal of patients with various diseases. The studies show beneficial psychophysiological effects of prayer in cerebral blood flow, increased parasympathetic activity, increased and decreased sympathetic activity, increased prefrontal activities of the brain. And these are the studies which I have quoted in support of this. And the similarly efficacy of zikr. Therapy has also been reported among Indonesian cancer and heart disease patients in alleviating psychological distress and surgery related to anxiety. Quote, and among patients with prospective abdominal surgery. So in the last 5 years, a new trend has emerged that is tapping the positive physiological effects of zikr therapy through physiological measures such as blood pressure, respiratory rate, pulse, temperature, and SpO2. In Aligarh Muslim University, also we have conducted two experiments in which we have made an attempt to examine or show the effect of Surah Al-Rahman with meaning. So those who recite Surah Al-Rahman with meaning, it has helped to a great in reducing the mental health problems as compared to those who simply recite Quran verses. So in particular, we find that cognitive restructuring predominantly with Islamic content begins in managing symptoms of post-traumatic stress disorder. The role of Islamic spiritual care along with palliative care is effective in reducing hospital anxiety, depression, and psychological distress of patients undergoing chemotherapy. The general trend is there with regard to the empirical studies, that is the demonstration of Islamic belief on people's attitude towards health related behavior, towards self, and towards society at large. The integration of cognitive behavior therapy with the Islamic literature related to trauma and suffering for cognitive reappraisal and cognitive restructuring of the clients for healing. The religiously informed CBT process is also effective for Muslim clients suffering with panic disorder, agoraphobia. Islamic hope therapy and forgiveness therapy has emerged as the eclectic approach to therapy. So similarly here, just I would like to quote one of the great Islamic scholar, Maulana Ashraf Ali Thanvi, though who was not a psychologist, but his contribution is great in the field of Islamic psychology in the sense that he used to practice bibliotherapy and communication therapy and group therapy, that is in the form of religious congregation, in order to reduce the physical and mental problems. The Islamic spiritual care with palliative care in the hospitals reduce patients' mental health problems such as hospital anxiety, depression, and distress. The recognition and application of physiological measures, such as the effect of gravity on blood pressure at different salat positions to measure postural reflexes. For example, uh, I have come across one study in which it was found or reported that those who perform on the posture of sujood, that is sajda, it helps in the management of blood pressure. So similarly, MG activity of the erector spine and trapezius muscles during the Islamic prayer has brought the efficacy of Muslim prayer into the realm of core sciences, which can be called a new trend in Islamic psychotherapy literature. The use of biophysiological measures such as heart rate, blood pressure, joint motions, angle of postures, and visual analog to assess the positive effects of prayer among people with mental health issues like depression and anxiety and physical health issues is giving a new direction to the literature. The integration of Quranic recitation and zikr therapy with physiological therapies have yielded satisfactory results in the management of preoperative anxiety of patients with physical diseases like cancer. The future mission. What I here I would like to give some of my reflections with regard to the training. At present, we do not have Islamic training programs. Universities or recognized institutions should offer a diploma in applied Islamic psychology. We should focus course on academic and research aspects of clinical psychology and in service training more on clinical practice. The masters in degree in psychology, social work, theology, or Islamic studies may be considered as the eligibility criteria for recognition registration in this course. Because being a member of the external assessor in some of the foreign universities, uh, what I found that some of the scholars of the faculty members, they are concentrating studies, conducting studies on the Islamic psychology, particularly in the field of theology as well as the religious studies. So this training program may be accredited by the International Association of Islamic Psychology, USA, or the International Association of Muslim Psychologists. The, I also give some suggestion the structure of diploma in applied Islamic psychology. It may be basis for registration or eligibility in the course like MS psychology, Islamic studies, Masters in social work or masters in theology. Duration of the course may be 1 year. Number of seats for trainees may be 20, or it may be based university or colleges accredited by the University Grants Commission, like in India, New Delhi, or state government. Entry criteria, it should be based on the competitive examination. The minimum qualifying percentage should be 60%, weightage of course, academic teaching 25%, supervised practice 50%, and dissertation related research maybe 25%. So basically, the aim of the training program will be to provide trainees with systematic opportunities in teaching and placement to utilize psychological knowledge in practice in order to conceptualize and implement interventions with people presenting a wide range of problems in various settings in which clinical psychologists are likely to work. So what is important is so much the particular technique, but the training that directs their use. In particular, Islamic practices touches inner spiritual heart. So, in the context of Islamic psychology into clinical practice, trainees are expected to be committed to decreasing psychological distress and promoting psychological well-being through the application of knowledge derived from the Quran and Sunnah. For this knowledge of and the skills, competencies, or training are required for training psychology. Similarly, I also give suggestion with regard to the statutory registration also, and should be conducted requirement to do clinical practice in the area of Islamic psychology. For this, International Association of Islamic Psychology's goal should be to accept the Islamic psychology as a profession. Registration can be done by the institution responsible for the award of the diploma in applied Islamic psychology, and are the individual who obtain certificate from the recognized university. This may be major shift for a qualified clinical psychologists who are required to register with the International Association of Islamic Psychology and International Association of Muslim Psychologists also, because frankly speaking, most of the countries, like in country like in India, where we have after the scope, as regards to the scope of Islamic psychology is can be broadened only when we start training program and the statutory registration. Uh, Otherwise, we have a number of programs like MPhil program in clinical psychology and PhD in clinical psychology from the recognized institutions. But here we need to, offer our services, as well as program or accreditation courses, and in order to implement the effectiveness of Islamic prayer. Similarly, future of clinical psychology into practice will continue to specialize and subspecialties in the context of assessment, consultation, and treatment. This will require the use of empirically supported and evidence-based assessment and treatments for psychological and behavioral problems. For example, I have also developed a number of psychological tests based on uh, spiritual practices, based on Islam, Muslims, and spiritual based practices based on Hinduism, because both have different perspectives, and similarly spiritual belief scale. Uh, to such type of assessment is there in order to proliferate or in order to widespread the field of uh, Islamic psychology in research. Until unless, because when I we prepared the annotated bibliography, so we found there are 45 psychological tests which are available throughout the world, and but anyhow their scope is very limited. I hope that by introducing or by knowing the people that a lot of work has already been uh, done in the area of Islamic psychology, and most of our younger generation will further be motivated by this. So most of the psychosocial problems such as aggression and violence, prejudice, psychological poverty can be altered with the help of Islamic approach to clinical practice. The behavior of people is troublesome. In world today, Islamic clinically oriented interventions can be useful in altering behavior of individuals. So of course, we need networking and collaboration with other mental health professionals. For example, like in our university, we have started Muslim chaplaincy program. Uh, and so within that, we cover certain approaches like Islamic psychotherapeutic interventions. So it may be directly with the individuals, married couples, families, Muslim communities, or indirect with family and healthcare givers. So clinical psychologists may adopt a theoretical model which will influence the type of psychological service offered for enhancing the well-being of individual. The main purpose of clinical psychology as a profession is to impart training to clinical psychology. So, of course, there is no doubt these as regards to the future of clinical psychology, it may be affected by the funding of training places, decision to impart training programs to overseas students together with the charging fee, cutbacks in psychological services, facing new challenges and ethical dilemmas for training programs in the context of Islamic psychology. So, of course, we need to develop appropriate broad-based curriculum, teaching methods, considering the mental health care priorities so that trainees are prepared for their future roles and responsibility. Because we are not supposed to teach, the scope of Islamic psychology should not be confined only to the teaching. Rather than we should also uh, widespread into the field of research, training, as well as practice. So future directions in assessment Islamic psychotherapy, the following trends are likely to affect the direction in assessment Islamic psychotherapeutic techniques in the 21st century. Islam and its philosophy, Islamic practices must be integrated into treatment to enhance the well-being of individual. Well-being means physical well-being, mental well-being, social well-being, emotional well-being, and spiritual well-being. The assessment tools need to be standardized for diagnosis. Frankly speaking, we have tools, but the tools what we use develop in the Western countries. They may not, in fact, really tap uh, or help may be helpful in identifying the behavior of the Muslims client. So diagnostic tools should be used to provide direction for effective treatment. Assessment plays more important role in classification of the nature and severity of problems, treatment and monitoring of treatment effectiveness. For example, as far as the psychological disorders is concerned, when I found or got an opportunity to read the literature based on the Maulana Ashraf Ali Thanvi, what I found is that he also made a classification, and those disorders may be considered as the functional disorders. So, of course, combination treatment approaches, integrate Islamic approaches with behavioral intervention need to be developed. Ethical guidelines need to be enforced. The use of Islamic practices and interventions in the clinical practice. Islamic practices and intervention will need to be incorporated in the development of early prevention program for mental health problems. Islamic psychotherapeutic model will continue to become the norm, and clinical psychologists are expected to use evidence practices such as prayer, dhikr, recitation of the Quran, Islamic meditation, or contemplation. What the Malik Badri, of course, I read a book written by Malik Badri on Islamic contemplation, and that is very informative and more thought-provoking. And I hope that the research will continue to focus on preventive and treatment approaches that are linked to the treatment of effectiveness. So new models of Islamic psychotherapy will be proposed, and the existing models needs to be revisited or refined. So religion and spirituality need to be integrated into the assessment and practice of Islamic approaches so that holistic focus may be on body, mind, spirit, and heart. Frankly speaking, the Western psychologists like Viktor Frankl give more emphasis on the triune aspects of health, that is body, mind, and spirit. But I have included heart also because in the Quran, the emphasis is more giving more on the heart. And there are, to the best of my knowledge, there are 137 uh, ayat or surahs are related to the heart. And the heart, what I understand in the Quran, is not the simple. Rather than there are three layers of heart, known as you may say sadr, and as well as lub, mm, and the fuad. These are the three main components of the heart. The Islamic practices should be considered as self-help program and homework tasks such as adjuncts to treatment. This will increased because of the contribution and the role they played earlier in terms of effectiveness. The collaboration between clinical psychologists and other mental health professionals need to be strengthened to deal with behavioral and mental health problems such as violence, suicide, trauma, stress, anxiety, depression. So at the end, now I would like to conclude that Islamic psychotherapy and Quranic therapy cannot be easily described in general statements. It varies depending on the personalities of the psychologist and patient and the mental health problems a client is experiencing. Instead, it relies more on the faith of a client in order for the therapy to be most successful. Muslim clinical psychologists need to identify Quranic verses which may be helpful in dealing with various types mental health problems like anxiety, depression, stress, sadness, anger, frustration, tolerance, loneliness, etc. These are the certain negative psychological states in which it can be more helpful. So, of course, the psychological evolutions of Islamic practices and Quranic therapy can have psychological and spiritual benefits. For example, we have a number of empirical studies which provide evidence about the role of prayer, dhikr, and Quranic recitation. Similarly, Islamic prayer and dhikr have a great role to establish connection with God. Recitation of the verses of the Quran gives valuable insight during observing prayer. The contents and types of verses may vary from client to client during prayer. Our observation is that psychologists should do the analysis of those verses of the Quran which have impacted the behavior of clients to a greater extent. These psychotherapy notes should be kept in clinical record. The most stereotyped perception of a psychotherapist is to treat individual clients in outpatient settings, where clients attend appointments for an hour in a week. The main aim of therapy is to reduce psychological distress and to enhance psychological well-being of a client through the application of various psychotherapeutic techniques. Frankly speaking, the Islamic psychotherapy or the Islamic counseling, there is no such thing like a termination. Because suppose if we divide the psychotherapy into three phases, opening and development or elaboration phase and ending phase. So of course, say for example, suppose if the client says, okay, I'm feeling okay, and uh, I do not need further to pay visit to your clinic or something like. But we should not say we can get that okay now you stop doing prayer or Quranic recitation because it leads to the further growth. So of course in Islamic psychotherapy or counseling there is no such thing like a termination, yeah, uh, of uh, things. So Muslim clinical psychologists working more exclusively problems focusing uh, uh, and with the psychological problem focused on treating, preventing problem through Islamic practices such as Quranic recitation, zikr, and meditation. The idea that Islamic and Quranic therapy promotes well-being of people by systematic application of Islamic practices. So, of course, this must be implemented in a more professional manner. Includes clarifying outside what can be expected from Islamic psychotherapy or Quranic therapy regarding confidentiality, arrangement, and training status. So, psychologists should assess the level of faith of a client, but he should not work toward termination of a professional relationship. And Muslim psychologists working in clinical activities must make their role and limits clearly to the other professionals like chaplains, counselors involved in helping people understand their behavior as well as finding ways to improve the quality of their lives. So we can think of that the treatment through Islamic approaches result in an important change for the betterment of people. Islamic practices can have significant effect in terms of impacting family, friends, and co-workers. Okay, thank you very much for patient listening.
Jazakallah khairan, Professor Akbar, for that very informative presentation about the research that you have conducted in the area of Islamic psychology, mental health, and in its practice. And then also proposing, after your wealth of experience and many years in this area and field, what needs to be done to give it a more applied approach. I remember in about 20 years ago when Dr. Amber Huck was putting together a paper about, what is Islamic psychology and how we can learn it in an academic institution and an undergraduate degree. So, fast forward 20 years, we're now talking about how we can actually implement and put together an applied clinical psychology degree. So we've actually come a long way in talking about basic concepts to now looking at professional practice, which I know that and I'm sure we've all been there, where us as students, who study psychology, where the first 4 years are predominantly theory, we actually get excited about the actual practice. And as practicing and inshallah observant Muslims, and those who have been practicing psychology or counseling or mental health with their clients know the importance of integrating the Islamic principles in the professional practice, and how that can lead to better mental health outcomes at shorter intervals. The issue is that a lot of us do it in practice, but we don't do research. So you emphasized the importance of research. So not only should we be getting involved in Islamic psychology and not just learning and practicing, but also trying to conduct research so that we can actually show the world that integrating Islamic principles has a lasting effect for our clients. I'm wondering, in terms of the clinical applied practice, if I am not incorrect, and I think Professor Rasul is in the audience. He actually, I think in 2022, so this year, he's got a graduate diploma in applied Islamic psychology and psychotherapy, if I remember correctly. And I think that that's a good movement. We're moving towards the applied practice of Islamic psychology as we're all trying to navigate. And I do see the promise, and given your experience of ensuring that there are accreditations so that we can have a normed understanding of Islamic psychology across the world, because we can all have different cultural perspectives, but essentially where Islamic psychology is concerned, there are some core themes and concepts that we can actually all agree on. And I'm going to open the floor for questions, because whilst we've got Professor Akbar here, I think we should take advantage of his skill, knowledge, and influence, insight, and research to be able to ask those questions to him. So are the questions going to be put on the screen, or are we going to allow people to ask questions live? So, because commonly we get the questions on the screen and then we allow the speaker to answer. But if they're not coming on the screen, would anyone like to ask a question to Professor Akbar? Oh, Farah. Sorry, Farah has got her hand up.
Yeah. Sorry. Assalamu alaikum. So I'm not sure if this is the right place to ask these questions, because we're talking about clinical practice. So I just want to ask maybe to Dr. Akbar and you yourself, Dr. Hanan. I have had some clients who struggle to perform salah during their depressive episodes. When they had their anxiety episodes or their depression, they had really huge struggle to actually perform salah. And some of them are actually really good Muslim. They're very pious and religious, but whenever they had that episodes, they just couldn't push themselves to do anything. That's the point of being disorder. It's the whole daily function is affected. So I try to encourage them to start from a few salat first, maybe not to leave the whole 5 fardu, but try to perform 2 or 3, at least you do something. But sometimes they can do it, sometimes they kind of relapse, they go from 5 back to 0. So my question is that what would be the best practice? What would be the best way to help, clinical patients in this situation, and what could be preventive strategies, because they're going to have another episode. So how do we help them to, with another one? Yeah, that's all. Thank you.
So Professor Akbar, would you like to answer that query?
Farah, okay, during the course of Islamic counseling, actually, first I realized to the client, because a number of students, they come that every day we observe 5 times. Some students say that we observe 3 times prayer in a day. Even that we suffer from depression or anxiety. So in this context, I used to first simple analysis. I used to tell them just to in order to what is the significance of prayer. First, I told okay, the word prayer. There are 6 letters: P, R, A, Y, E, R. P stand for, so if you when you perform prayer, of course it helps you in the purification of the soul or heart. R means remembrance of Allah. It means when you pray, it means you remember Allah. A, attention, you pay attention to God. Y, you establish yearning, that is connection with God. E, prayer develops eternal consciousness. And R, it helps in the recovery. So these are the 6 benefits I used to tell them linked with the prayer. And now, whenever you perform prayer, you should have a heartfelt attitude towards observing prayer. Because in prayer also, sometimes when we observe prayer, we have a different motive. Some people's motive is to, those who are pious, their motive is to establish connection with God or establish yearning with the God. But those, they pray for the material benefits. Some people pray for the others' well-being. So in this regard, I would like to quote one of Prophet's saying that once a Bedouin asked to Prophet Muhammad sallallahu alaihi wasallam what one should do or after prayer or salah. So he replied, pray for your well-being. He replied 3 times, pray for your well-being, pray for your well-being. So definitely a number of evidences are available where it is found that the prayer improves physical well-being, mental well-being, or emotional well-being. Or when we perform prayer in collective manner, it improves our social well-being also, and as well as existential well-being also. So so of course, it means before you start any psychotherapy program or the counseling, you must give a brief orientation about the therapy or brief orientation about the Islamic practice, what you want to implement or enforce in the case of the client. And he also asked whether he has belief in it. If yes, what is the level of it? Then how he thinks that this is very important for enhancing his the well-being as well as improving the health-related quality of life. I hope that Farah, you will be convinced with my answer.
Yes, thank you, doctor. That's a lot in in this short answer. Thank you so much.
And mashallah, I think that, it's the first time that I hear an acronym for prayer. I might, if the organizers can put it through the chat box. So for P, it was perform, and R, it was remembrance of Allah. A is attention, Y is yearning, and E is for eternal consciousness, and R is for recovery. So that's the first I hear such an acronym. It's actually quite powerful, and it's something you can start talking about straight away with your clients who struggle with salah. And I think that it's important. Even the last R, which is recovery, because we know that iman fluctuates over time. Can fluctuate over time. So when we're talking to our client about recovery and we have a very positive view of Allah, that Allah subhanahu wa ta'ala is merciful, he's very compassionate, and we always try and advocate for our clients to recover from their psychological illness. It's actually quite a powerful acronym. I think you should develop it further, Professor Akbar, because I actually, it's the first time that I hear it. And I think most of us as well. And I think that's something we can actually implement in our clinical practice with Muslim clients.
Yeah. Okay, thank you very much.
You're welcome. And we've got another question by Misbah Rafiq. So if you'd like to unmute and ask your question.
Assalamu alaikum.
Wa alaikum salam.
Sir, I wanted to know from where can we get your book, the annotated bibliography?
Yeah.
And
I mean,
also wanted
yes.
to.
Okay, and it is in press basically because there were few corrections which I did day before yesterday. So, okay, I will send to Mr. Babu's and the committee member one book, this to our Vice President, Dr. Hannan Dover. I will send one complimentary copies to each
Jazakallah khair.
member of this, because it will be helpful, frankly speaking, those who are interested in conducting researches in this particular field. Otherwise, earlier we were totally blank. What is the scope of why we should conduct research? Because recently I guided one PhD thesis in the area of Islamic counseling. That is the problem of that candidate is elevating mental health problem through counseling interventions. Another book I am writing at present is Quranic Virtues, the development of idyllic personality, because this personality word idyllic is more closely embedded with Islam, that is the peaceful coexistence. So what are those virtues, Quranic virtues, which may be more helpful particularly for the teachers, for the educators, as well as the counselors, for the development of the idyllic personality of children. So this, so inshallah, Misbah, don't worry. I mean, I will send one copy to Mr. Babu's and one copy to Nandover and Diana. 4 or 5 copies I will send to Indonesia, and
Thank you,
it's a
bro.
PDF copy. And there is no such thing like an because it is related to our mission, that is the dawa, not to sell or earn money. Whatever the knowledge, if you want to share in the case of conducting any controlled studies, you can, of course, and you will find a lot of references, because on the top of each abstract, that is the annotated bibliography, on the top of each abstract, I give the full reference of that particular article in bold letters. So you can search that studies. If you are interested in studying the full text or the full paper, you can study that. Because there is about 2 years ago, one study was conducted in Pakistan. It was on assessing the effectiveness of Surah Rahman in the treatment of psychoneurotic disorders. So they treated 12 patients of psychoneurotic disorders simply by listening of the Quranic verses on Mona Basit, and they get cured also. A lot of literature is coming, and it is a good area which needs, because as I told you, is that in Islamic psychotherapy, Islamic counseling, there is no such thing like a termination of therapy. You can continue. The clients can continue because it will help to the client to grow further, or it will be more meaningful for flourishing or well-being of the client.
In this regard, if I may say that if termination is not the case, so how can we differentiate a counseling therapy with that of being in connection with the sheikh? Like there is a culture wherein people are having a sohbah with the sheikh, and sheikh is like lifetime. They have any problem, they go to the sheikh. But in case of a counselor, it is
Yeah. I
over.
mean, of course, Siddiqui, Misbah, as far as the healing is concerned, there may be 3 types of healing: self-healing, contact healing, and distant healing. Okay. So here, I mean, as far as the sheikh, if of course visiting the clients with the sheikh for the longer duration, just like a psychoanalytic therapy, is not necessary. Even sheikh can do from the distant also. Here, my emphasis is that say for example, chanting or or performing prayer or having fasting or something like that. So we are continuing because it helps in the development of steadfastness. Fasting develop the steadfastness. So here, the distant healing, of course, not only the contact healing is important. From the point of view of the contact healing, the client's relationship between the client and the therapist may be terminated, but it may continue at the distant healing because okay.
Thank you, sir. Thank you very much. Thank you very much.
Okay, thank you.
I think that your prayer acronym is becoming very popular. I've got my phone and I'm on Islamic psychology WhatsApp chat groups, and they're all asking, "Can someone please type, the prayer acronym?" So I think it's going to spread, and I think you're going to have to write a book or an article.
Yeah, I wrote. Okay, Anna, frankly speaking, I will send you one of my recent book that is Applied Psychology, New Interpretation. Within that, I made analysis of all Islamic practices, prayer, fasting, Hajj, and similarly this jihad also. Jihad acronym I also analyze. J stands for justice, seeking justice from Allah. Jihad. I, inner harmony. Okay, inner struggle. H, harmony. A, that is active. Or D, divine unity. You fight for this. So all acronym I give, even the Quran acronym I also analyze. Q stands for first for entering into paradise. U for universal book. It is for universal. And R for revealed book. Okay. And N stands for no compulsion in any religion. Okay. Like this. Okay. I will send you the whole book.
Mashallah, I hope everybody has been taking down notes.
Because it will be more helpful in doing counseling or something like that, because realizing or the telling to the significance of these virtues, why these virtues are important. So I made the psychological analysis as written in brief about all these things, all the Islamic practices I wrote.
And even Professor Akbar, they are, those of us who conduct clinical counseling know that, people who are suffering, their cognitive or attention span is not so wide. So when we're giving them those small, references to prayer, what it means, perform, and then, for example, remembrance and attention, they're likely to remember that. But if we're going to give them a whole spiel, a whole essay about, why it's important to pray, they're not going to be able to retain all that information. So they're really good ways. And these days in social media where people are sending memes and brief advice, I think that you've come at a good time with these acronyms, where people can actually put them in their social media and start promoting them, because young people really need the deen more than ever, given the problems associated with social media. So if we can filter out, what is not beneficial and filter in, what is beneficial, I think that, Ummah will actually go a long way. Okay, so does anyone else have a question? So there's nothing in the chat box. Would anyone like to ask another question before we move on? Okay, because if you don't, I would like to thank Professor Akbar for his time and his many years of contributions to the International Association of Muslim Psychologists, his invitation to us for hosting the 6th International Conference in India, and may Allah subhanahu wa ta'ala raise your ranks, continue on your intellectual jihad to help us young people. You're young yourself, to help us all, inshallah, further in the discipline, theory and practice of Islamic psychology. May Allah subhanahu wa ta'ala reward you and raise your ranks. Jazakallah khairan.
Okay.